Okay, Ralph Havens here, physical therapist, and I'm with Tom Giammatteo, one of my longtime teachers, friends, colleagues. Dr. Tom Giammatteo, a chiropractor, naturopath, one of the co-developers of integrative manual therapy. And, I just finished a wonderful set of sessions with a client who flew in from out of town. And we did 3 days over the course of 4 days, 1 day off, but 3 days of multiple hours of healing sessions to help this person out. And Tom just told me he's flying out to the West Coast to work on a whole bunch of people. And the idea is do a lot of intensive healing. It's literally called an IMT intensive in a short amount of time. And I want to talk about that because if you're a practitioner, a doctor, if you're a chiropractor, massage therapist, it might seem crazy. Like, how can you wouldn't do hours and hours of chiropractic adjustments, manipulations in a single day on somebody, or hours and hours of massage, or even hours and hours of exercise. It wouldn't do very well for the person. They'd be very sore. And but with IMT we do, and I've had 7-hour treatment days, and it solved a lot of problems for me. So we're going to talk about healing and this other way of thinking about chronic stuff and how to truly transcend it. So Tom, I want to welcome you. Thanks again. I always love having you on a couple of times a month. It's so good to see you.
Thanks, Ralph. So
and one of the things I wanted to just anything you want to say about it? We my client, I was telling him about some of the ideas of how we find the actual cause, and also how we treat with an indirect way so that the body can keep doing multiple hours. And just basically it's like taking coming in and just having your body transformed and healed up, and then you leave a totally different person. Anything you want to say about that?
Sure. So I'll start with my warning this morning, where we have a client that's comes in every 5 to 6 weeks, and she lives an hour and a half to 2 hours away. And so she had an inflamed knee, very stiff, and we've been treating her for her bunions and really distorted feet, and now her knee hurts. And so we did a 6-hour time in 3 hours, believe it or not, because there were 2 of us working together or separately in different projects at the same time in the body. So she left and her knee felt 95. She didn't have any knee pain in there. And over the time that we've been working together, her bunions have improved, her foot pain's improved, her bowel and bladder have improved along the way, where she used to make a bowel movement every 3 to 4 days and be constipated. And now she's every other day. And we were having a loud discussion that she goes, well, that's my normal status. I'm saying, no, that's not your normal. That's not a healthy normal status for the model of being human. You should make a bowel movement 1 to 2 times a day, 3 times a day. When something comes in, you have the natural flow, it should come out about 20 minutes later. But our society has made us tight and impinged. So she moved from twice a week now to every other day. And I'm still saying that's not good enough for me. And she's happy with it. And it's just saying, no, that's not right. And she goes, well, that's just me. And I'm saying, no, that's not right, because that's not healthy still.
And she came in because of a knee pain. She didn't come in thinking she was going to get the other.
Well, she's on a cycle where this is a woman that is busy. She lives away, so we've trained them they come in for a 3 to 4 hour slot once a month or once every 6 weeks, and then they go live their life. And you're asking, well, how can we do that? We do such refined work and such precise work, but it almost has to work like potter's clay. You have to get the energy into the body, and then it can move, right? And we're doing fascial releases, and sometimes it feels like it's been welded on metal, right? And we want the fascia to move and glide. So my example of that is when you have a beer bottle during the summertime and you put it into a cooler, and when you take the bottle out, and the label just falls off and it's slidey. That's the ideal scene of fascia moving on muscles, moving on tendons, moving on bones. We want that glide, we want that capability. But if you take it out and dry it out, you can't even peel it without having the paper stick to the bottom. So we're trying to redefine those planes and redefine all those things happening.
Because everything inside of us should move on each
Right,
other.
and glide, right? Just like your skin should glide over here. And everybody's experienced giving somebody a shoulder run up and one feels tighter than the other. So that could be the muscles in spasm, but it could also be the fascia holding it down. And another example of unhealth of that is if you've cut yourself with a paper, across your knuckle, it's stiff for the next couple of days until you get the mobility back, and then it glides back and forth. So we need those.
How do you explain how could somebody possibly tolerate two people for 3 full hours doing body work? You couldn't do massage like that. I mean, you could, but it would be pretty sore.
It's very specific, and it takes some tolerance to get up there, but it can change somebody's life, because sometimes we're lightly holding the body and the taffy melts around it, and sometimes you need to be that patient because it's gone in such a slow mode. You also need to take it out in a slow mode. And traditional chiropractic, you see somebody crack somebody. In the beginning of chiropractic, they used to have chiropractic hospitals where somebody would get a 10-minute, they'd work on for 10 minutes, they'd pop their back, and they'd come back the next 2 hours and do it again and do it again. And they're resolving a lot of things in that whole world there too. But if you go to Ayurvedic medicine, like Deepak Chopra medicine from India, they will do, colonic, then they'll do a body massage, and then they'll do a rolfing session. So there are spas and clinics out there that will do a whole day of sessions of different types of body work that are there. Our insurance-based model in the United States is horrible. You have a procedure, you charge for it instead of having these whole days of doing those things. And you had talked about we do still have intensives where people fly out. So I have probably a third of my practice is people fly out for a day or 2 days, get 5 to 6 hours in a day, and then go back, and they heal for a month or two.
And that's what I used to do, is get 4 hours every 6 weeks. And there was times when I got 7 hours for 3 days in a row. And it's not to say it takes that long to have a big result. I remember the first 2-hour session, I resolved a calf spasm that was stopping me from running after 8 months of not being able to run. And it was from the practitioner working on around my heart, which might sound like what? Like a massage service. What do you mean working on the heart and the arteries? And one of the things we have in IMT is this idea of an indirect approach versus a direct approach, and how the body can keep unwinding with its own wisdom and not us trying to force something. Can you talk a little bit about what's the difference between like an indirect approach that a lot of IMT is based on versus like a direct approach like rolfing or regular manipulations?
The direct approach is finding it, feeling it where it's stuck, and push it further.
How to stretch it.
Right. Like most of the people doing stretching nowadays, like we've all had our hamstrings stretched, where you lie down on your back, somebody puts your leg on their shoulder, and they just keep pushing. And when you get to the end, they wait a few seconds, they push deeper and they push deeper. And that's really an irritant to the system, and you actually cause more scar tissue sometimes. I describe IMT almost like a gold chain with a knot in it, right? If you pull on the ends of the knot, it's not going to unhook the knot. You have to back it up, loosen it up, and then pull the knot through where it came from before. And that's what we do with this indirect technique. We sit there, we never push anything into the body. Some therapies do that, and it's called a direct technique. Even in craniosacral work by Upledger Institute and John Barn work, talks about going into the resistance and holding it there into that area. And we've done all our research, and 95% of the time we are backing off where the ease is and just hanging out there and let the body figure out, oh, this is easier now. Maybe I could figure a way around that process. Another example of that is if you have a fork in the kitchen drawer and it jams up, you you can't, it's like jamming the drawer up and the fork gets more and more bent. But if you push the drawer in and shake it a little bit, then maybe the fork falls down. And
Yeah.
that's 90% of the therapy we do is that way.
Yeah, because there's a nice reflex that goes between the tight area in the spinal cord or the brain,
Yeah.
and it kind of resets that whole thing when you put things on slack, and then it lets the body keep unwinding as much as it wants to unwind. You're not forcing anything, you're just letting it have the next thing to do.
So we teach a technique called myofascial mapping, where we actually feel the tightnesses in the body. And if you release one, another one will release. It's almost like the camel who broke its back. You have to figure out what straw is going to give you the biggest return for that whole process. And you lightly take that one out. So an IMT therapy, sometimes it's 20 minutes of moving around, figuring things out, and then you pick the right technique and everything releases. You can hold on to an ankle and you feel like your sinuses open up, your shoulder changes, your vision improves. And this woman with the swollen knee, I was working on her ankle below the knee, and she goes, "Oh, my throat's getting tight. Oh, now it's better. Now I can talk better than I had before." So it's interesting how the fascial planes weave through the body. And if you bring the body's awareness to it, the body actually has some pulses. One of them is called the craniosacral rhythm, that every time you take a breath in, the lungs pull everything out, and you come back together. So if we create a hold stop on one of those, then the body is actually wrapping around and coming out of it, wrapping around, and it's releasing that way. So you have ever seen somebody stuck in some sand? They have to rock themselves out of it to get the car out of the sand. And so the fulcrum holds that point so that the body can swing and release itself.
It's really a fascinating way to go. I've literally had a client once just keep going, wow, this is fascinating, because as her she came in with neck, arm pain and tingling. I had to actually send her to the doctor just to make sure it wasn't an official heart attack, and they were like, no, it's fine. But I was working in different areas, and she was reporting all these symptoms coming and then going and then coming and going, and then it cleared. And it's all about finding the primary actual cause and not looking at symptoms. Like so many, you have your certain tools as a practitioner, and if it's, if you have a tool for massaging muscles, you'll see muscles, and if you have a tool for joints, you'll see joints, and if you're medical doctor, you'll think of maybe a surgery or a drug. And one way I think of it is like if you have a fire that's in your neighborhood and is starting to get to your house, there could be lots of cops and police and or the police, the firemen, there could be sirens, there's like water damage happening to certain places. And if you saw that, you might think, good Lord, I can't sleep around here. Somebody send all these police and firemen home. I need to sleep. But you didn't, and that's kind of like many models is like, what are the symptoms? Oh, too many police and firemen and too much noise here. And let's send them all home. And that's like one way to think of like, how can you just relieve some of the stress? We think of finding the primary thing, and the mapping is what's really drives this whole thing. I loved it this last few days working with a client for multiple hours, because as the mapping cleared, then we would get to the next level and do stuff. One of the reasons sorry about the lawnmower in the back, the idea, what was I going to say? This idea like multiple hours of sessions versus 1 hour. Like I have some clients that take 1 hour at a time, and I think of it like, you can clean the house, but if you just have an hour, you can only do so much, and you got to make sure everything gets put back or it looks not so good. If you have a few days to really clean the house, redo floorboards, go take stuff from behind the refrigerator and stove and clean the whole thing, you can do a lot more work. But if you do only an hour of that work of like start to pull the refrigerator away, start to pull up the carpet, somebody comes in at that point and go, this house is a mess. So can you talk about like the benefit of like the idea of like 1 hour of sessions? We could do magic. You could do magic healing in 1 hour. And there's some benefit about multiple hours.
So we've had many different models of trying to do integrated manual therapy. And we were also trying to fit into the insurance model back in the early 2000s. So we had some of our therapists that were registered with Blue Cross Blue Shield is another company when they're in network. And their network, what happens when you have an insurance model like that is when you're trying to pretend you're a physical therapist, or you're trying to pretend that you're working as a therapist and you're giving service codes, they pay X amount of money for each service code. So we charge in the office currently $165 an hour to work with one of our practitioners for 1 hour, be it doing paperwork or doing physical touch to the person. And so in order to pay our staff and to, make sure that we're not going bankrupt, we figured that in the Blue Cross model, we can only do a half hour, and we could give these different codes to cover that. And we looked at that person getting better and following their treatment plan. And then we looked at an hour, and then we looked at people that were coming in for intensives. And it would take almost a third longer for the person that was doing the half-hour visit versus the hour visit. So we came to this conclusion that everybody needs, they're rushing in, they're rushing out. Everybody needs to settle down on the table for 15 minutes, and then the body will appreciate the work. So if you stack that into an hour, if you're doing a half hour, you're going to get really 15 minutes of really good treatment time. And in an hour, you're getting 45 minutes. And then in a 2 or 3 hour session, you're getting all that extra 15 minutes back as continued time. So it's going deeper, and it's exponentially more powerful in that way too.
It is, yeah. The body starts to really recognize, oh, I'm getting taken care of, and we're fighting big stuff, and it just starts to let go of stuff so fast. I know when I was starting to do the joint techniques for the pelvis, it had been after 2 days of all this other stuff, of clearing stuff, and it just went so fast. Whereas if it was just, the first day, try to do the joint techniques, the manipulations for the joints in the pelvis, I'm pretty sure it would have been a lot more of a slog fest, but it was just like,
Right.
oh, man, this goes so fast. And then she reported that just the pelvis felt really spacious and open. And so it's wonderful to have the time. So I wanted to open this up to people to get this idea of integrative manual therapy. It's a unique method that uses a very gentle and what's called indirect. It's using the body's wisdom and letting the body unravel stuff. And that's why we can do multiple hours. And that's why multiple hours can be really beneficial. So Tom is on the East Coast, West Hartford, Connecticut, but he is coming all the way to the West Coast in July for an intensive with some therapists and some clients. And I have people coming from all over the place. I just had somebody coming from far removed areas over here to Bellingham. And so, the key with this, what I want to let people know about is if other things aren't working yet for you, like you have a chronic condition, if you want us to take a look, we literally can over the phone, over the Zoom call, do a mapping assessment and start to check in oh, here's what I see that's going on, and give you some ideas of where we see the root causes are for you, and get you a plan. And if it's something that you really want some help from Tom or me, reach out and we'll direct you. There's practitioners around the world that Tom has trained, and I'm one of them, and we can get you the help. So it's Tom is at IMTWellnessCenter.com in West Hartford, Connecticut, and I'm at in Bellingham, Washington, RalphHavens.com. So reach out to us, and I wanted to get this information. Thank you, Tom. Anything else you want to say to practitioners or anybody else?
Our school starts the week of the 20th in September. And we have a 3-year program going around. If anybody's interested, you can contact me. I'll be happy to share more information on that. And we will be having summer school for the advanced practitioners the first weekend in August. I'm busy writing that piece up too.
Those are so amazing. Yeah, August, I'm writing that down. Well, thank you, Tom. And so if you're a practitioner, reach out to me. I can direct you, reach out to Tom. And if you need any help with your healing, reach out to us, and we can kind of point you to what we see that's going on, where the actual causes are, and some ways to do this. When I first started, like I said, I solved that what I called a running injury, 8 months of not being able to run because of a calf spasm. And that solved out in a session. It was a 2-hour session. And then I kept going and signing up for, when I first met Sharon and Tom, I instantly told them, I want you to come teach in my clinic. And so that's where we went. And then I went wherever they were. And along the way, I healed, I got rid of anxiety, a sweaty hand problem. I got rid of problems with my teeth. I didn't have teeth cavities anymore, which I had for my whole life. And we've seen that with our clients too. You can get your health back, you can get your life back. And I'll just say what Sharon said, you know, her thought is like helping people get healthy enough to get on their surfboard, to take their wave and do what they're here to do in life. And that's what it's all about for us. So Tom, thank you so much, man. I'm going to share this
Okay,
around
Ralph.
and I'll see you real soon. Okay. Let me just click this off.